Hello, everybody. This is part 2 of our digestive system video. The first video talked a little bit about what digestion was and started talking about the difference between alimentary canal and accessory organs, and it went over like parts of the mouth. And this is going to continue. What we're looking at is the alimentary canal, remember, is the food tube. It's basically the tube that the food passes down. And as we go, we'll talk about accessory organs that are related to that. So in the last video, we mentioned how the mouth or the buccal or buccal cavity or the oral cavity is actually just the opening to your digestive system. But in your mouth, you have your tongue, and your tongue would count as an accessory organ. And we talked about these things called papilla, which are your taste buds. Well, with this one, we're going to continue things that are in your tongue. We all have this little piece of skin right in there that's called the frenulum. Now in humans, this is an example of kind of what is called a vestigial structure. Vestigial structures are structures like our appendix or our wisdom teeth, things that we still have, we just don't need anymore. Our tongue does not need to flip out. So we do not really need this little piece of skin that's called the frenulum. And by definition, it's a fold of membrane under your tongue that anchors it in place. Now you know we have the ability to stick our tongue out and we bring our tongue back in. Well, in other creatures like salamanders or frogs, they can like really whip their tongue out, or like a snake. Well, that's what where this frenulum comes into play. And in you and I, it doesn't really have a purpose. And you've all heard this saying tongue-tied. And usually when somebody says, "Are you tongue-tied?" that means you have a hard time getting words out. Well, some people are clinically tongue-tied. Their frenulum can be too short, and therefore they cannot lift the end of their tongue. Now, if you think about it, when you talk, your tongue moves around. So like when you say the letter T, you know, your tongue goes to a certain part of your mouth. Well, people, if their frenulums are too short, they can't lift their tongues up. And so therefore it can affect their speech. Now, we all have that thing that hangs down the back of your throat. And you might have always wondered, okay, what is that thing? Well, I want everybody just to take a deep breath. That was kind of relaxing, wasn't it? Let's do that again. Well, as you're breathing in, you can feel that air goes into your throat. Okay. Our nasal cavity is attached to our mouth. We know that because we can sniff. Mucus runs down our nose into our mouth. That's how we clean the dirty mucus out of our nose. It goes into our mouth and we swallow it, and our stomach acids destroy it. Well, we have two nostrils, two sinuses. We have two holes on the roof of our mouth, and those holes are called our internal nares. And that thing that hangs down in the back of your throat is called your uvula. And basically it's there, so when you swallow, it folds over those holes. So if we have this hole, we have two holes which are called the uvula, or called your nares. The uvula is kind of in the middle of them, and when you swallow, it will fold over that hole. And that's to keep water and stuff from going up your nose. We've all had stuff go up our nose. It burns. Well, pain's your body's way of telling you to stop. Pain's your body's way of telling you that something is not working correctly. And so that's why when things get in our nose, it hurts, because things aren't supposed to be in our nose. Well, every time you swallow, you don't want stuff going up in your nose. So the uvula helps cover those two little holes. Now, sometimes, you know, when you laugh, stuff can come out your nose. Well, that's because when you're laughing, the air blows the uvula in the wrong direction, and so stuff can go up inside of your nose. Now, also in our mouth, we have our salivary glands. And our salivary glands, you actually have 3 pairs, or you have 6 salivary glands, and they make saliva. And saliva, as you know, is mostly water. It also has an enzyme called amylase in it. Remember, anytime you see ASE at the end of the word, that means you have an enzyme. And usually the name of the enzyme gives you an idea of what it does. Well, amylase is kind of iffy if you don't know like all these really big sugar chemicals. But amylase's job is to break down sugar. So the moment you put sugar in your mouth, your body immediately starts to break it down. That's why gum loses its taste, because gum has sugar in it. Even sugar-free gum has sugar in it. It just has a certain amount in it. And your saliva starts to break down that sugar. And once the sugar's gone, the taste is gone. And all that's left is the rubber component of the gum. And our saliva also has mucus in it. Remember, water helps make food mushy. It's easier to swallow. The enzymes are going to start breaking down sugar, and the mucus is there to help make the food slimy. It's easier to swallow slimy food. Well, a lot of people don't realize we actually have 6 salivary glands, 3 on each side of our mouth, so 3 pairs. And most of the time when people think of the salivary glands, they're thinking of what we call the parotid glands. And these are the really big ones. These are the largest glands you have. And you can see they're kind of located about where your ear is. And as you can see in this picture here, they add saliva to the roof of your mouth, more towards the back of your mouth. And it just kind of drains down over your cheeks. But you've all heard of a disease called the mumps, and honestly, every one of us have probably had the mumps vaccine. In the case of the mumps, it's a virus that causes these glands to get infected, and it causes huge lumps to form because it causes the salivary gland to swell, and so you get these really big lumps. For some reason, people call them mumps on either side of your head. We also have what's called the sublingual gland. Anytime you see lingual, that has something to do with your tongue. And you can see here that this gland is right underneath the front of your tongue. And this is what people talk about when they gleek. I don't know why it's called gleeking, but sometimes you can lower your tongue and your tongue will press down on that gland. And when your tongue presses down on that gland, it forces water out of those 2 little openings. You can actually look in a mirror and kind of lift your tongue up, and you'll see 2 little openings on either side of your frenulum. And that's where saliva comes from. We also have your submandibular gland. Your mandible is your jaw, and you can see it's down there, sub, and it also, even though it's more towards the back of your teeth, you can see it also drains in the front of your mouth. That's why we get all the saliva forming in the front of our mouth, because remember, back in the back of our throat, which we're going to talk about again, we have our opening that leads to our lungs, and we breathe while we talk, and we don't want all that water going down inside of our lungs. So your parotid glands are your largest glands. They empty the saliva more towards, as you can see here, your back teeth on the top. Then you have your sublingual and your submandibulars, which are releasing that saliva into the front. So these would be examples of an accessory organ. Other accessory organs you have are your teeth. As an adult, we have 32 teeth, 16 up top and 16 below. So that's 32 organs. People don't think of teeth as organs. When people think of organs, they think of your stomach, your heart. Well, each tooth is an organ because by definition, an organ is a group of tissues that work together. Well, we have different types of tissues in our tooth. Now, when we look at our tooth, we can divide it up different ways. So if you look at the outside of the tooth, we look at what's called the crown and the root. The crown of your tooth, this part here, let me choose a color. This part right here, the crown of your tooth is what you see when you look in the mirror. When you see somebody's teeth, you're seeing what's called the crown. So when people get crowns, they're getting basically fake coverings for their teeth, which we'll talk about in a minute. But what you would call the part of the tooth you see is called the crown. Now, just like roots hold plants into the ground, the part of the tooth that's in our jaw bones, that's called the root. And its job is to hold your tooth in place. So just like roots grow downward and hold the tree in place, our roots are there to hold our teeth in place. And when we talk about bones, we talked about joints. And a joint is any place where 2 bones come together. Well, our teeth are so strong, we actually consider our tooth socket to be a joint. If you remember, our tooth socket is a joint called gomphosis joint. That's why these are called your gums. Well, where the crown is above the jaw and the root is in the jaw. Well, our teeth, when we chew, our teeth move. So we need to make sure that something is holding our tooth in place. So we actually have this thing, as you can see here, called cementum. And cementum would be in here. Okay? It literally helps cement your teeth in place. Well, Our bodies are amazing things. And as you get older, your body has to start to kind of play a game. It has to figure out, okay, what's important and what's not. So this is why, like we said when we did the skin, that your hair is gray. Your hair is already gray. We just make hair color for camouflage purposes. Well, your body's like, okay, I don't really need to do this. I'm not hiding. I don't need camouflage. So your body stops making the melanin. So your hair's natural gray color shows up. Well, as you get older, if you don't have a good diet, or your body subconsciously realizes you're not really taking good care of your teeth, your body can stop making this cementum. And so if your body stops making cementum, your teeth will get loose. And this is why some older people who don't have very good dental health or might not have the nutrition that they need, their teeth get loose and fall out. So when we look at the outside of the tooth, we're looking at the crown and the root. We can also look at the layers of the teeth. Okay? Now, remember, every organ has a membrane that goes around it. Well, in the case of our teeth, that membrane would be our enamel. Enamel is the coating on the outside of our teeth. Then inside, if we could peel the enamel off, and this drawing looks like you only have the enamel on the top, you have the enamel on the entire tooth. You've had loose teeth before, you know your tooth is white. Well, if you could peel the enamel off, you have what's called the dentin inside of it. And that's also a tissue. It's a type of connective tissue. And we talked about how this is actually harder than bone. And then if you can peel the dentin off, you have this area here called the pulp. And the pulp is living tissue. This is where we find blood vessels. Because remember, your tooth is an organ. Tissues need nutrients. And so there's blood vessels there to feed the dentin. There's blood vessels there to feed the nerves that are in your teeth. And these are what we call, like if we were to peel off the 3 layers. Now, just like your skin has pores in them, your enamel and dentin can also get little holes in them. You've all heard of people who have sensitive teeth. Well, what can happen over time, different chemicals that you use, that you ingest, over time, they can start to put little holes, little itsy bitsy microscopic holes inside of your enamel. And those holes can actually get deeper and deeper, and those holes can form little itsy bitsy tunnels through your teeth. And those tunnels can actually reach down into the pulp. And so so it's basically like a little slide, like a little tube going straight to a nerve. So that's why people with sensitive teeth, if they eat something that's cold, it hurts, because that cold water actually made its way through your tooth. And as you get older, your teeth do get thinner. You're born with all the enamel you're going to have. You cannot make more. When that tooth comes out, that's all the enamel you're going to have. So as you get older, your teeth actually get thinner. So you're more likely to have these little holes, these little tubes that go in, and it hits that nerve. And so a lot of times you'll have to have a root canal. And what happens with a root canal is the dentist will go in, and actually, let me get rid of this stuff here. The dentist will go in and actually kind of cut your tooth off, kind of cut your tooth right here, and take that whole part of your tooth off. And then they'll pull the pulp out. Then they'll go in and they'll pack it with like an epoxy of some type, because we can't leave it hollow, because as we chew, that will cause our tooth to shatter. So they'll take out that pulp, that living tissue, and they'll put like a rubber epoxy inside of it. And then you have to get a crown. That's a fake tooth that the dentist puts on top of it. Now here's just another little diagram. So this part here would be your enamel. This part here is your dentin. This whole pink part there would be the pulp, the living tissue. And you can see the gum, and you can see the spongy bone that our teeth fit down inside of. And then down here at the bottom, you can see the arteries, veins, and nerves that go into our teeth. So All of this is found in what we would call our mouth. The pharynx is the next thing. So we go from the mouth to the pharynx. And again, my handwriting is not very good on this. From the mouth to the pharynx. And the pharynx is what you commonly call your throat. And a lot of people think of your throat as this here, and that's not the case. Your throat is actually what we would call the back of your mouth. And the scientific name for your throat is your pharynx. And your pharynx is actually shared by your digestive system and your respiratory system. So in the digestive system, we go from the mouth to the pharynx to the esophagus. And the respiratory system, we go from our mouth or our nose, because we can breathe in both, to the pharynx into our trachea. But like I mentioned before, this is a lot of people think that your pharynx is just like this tube, and that's not the case. This is also where you find your tonsils. And your tonsils are part of your cardiovascular system. They're part of your immune system. They are lymph nodes. And what a lot of people don't realize is that we have 4 pairs of tonsils, which we'll talk about that later. And if you could see your pharynx, it's not a continuous tube. Again, people think if they could shine a flashlight down their throat, they would just see this one long tube. And that's not what your pharynx looks like. Your pharynx actually has a wall in the back. It kind of dead ends. And it would be like you in a room that has a door, and when you walk in that room, there's 2 windows on the other wall. And each window leads to something different. So you have 2 openings. One of these openings is called the gullet, and the gullet is the opening that leads to your esophagus. So that would be the hole that opens up so we can swallow. The other opening is called the glottis. It leads to your trachea. And so this is the opening that's open so that we can breathe. And you cannot breathe and swallow at the same time. Try it. Okay. Well, 99% of the time you're breathing. So your glottis is open about 99% of the time, and the other 1% of the time your gullet is closed. And we talked about how your esophagus, the top part of your esophagus, is skeletal muscle, because you have to be able to feel yourself swallowing. Because everybody swallow. It actually takes you a second or 2 to swallow, because you have to wait for the gullet to close and the glottis to open. Now, in the case of your esophagus, the esophagus attaches the pharynx to the stomach. And the esophagus is just basically a tube. A lot of people just call it the food tube. It's just, our mouth is up here and our stomach is way down here. So we just have a tube that food passes through. And again, that tube is called your esophagus. And it only opens to let that food in. So that gullet, when you swallow, the top part of your esophagus is skeletal muscle. You have to tell it to open. That's why it takes a second, because your brain has to get that message to that muscle, and it has to open up. And then it closes again so that your glottis can open so that you can breathe. And so therefore, the top part of your esophagus has to be voluntary. Remember, that's skeletal muscle. You have to tell it to work. That's why when you say, okay, I'm going to swallow, it takes you a few seconds to actually swallow. Since it's skeletal muscle, you have to tell it to go to work, and you have to make sure that that tube gets opened. The bottom part of it is involuntary. And remember, skeletal muscle has feeling nerves. That's why sometimes when you swallow food, and once you swallow that food, it's called a bolus. It's a ball of food. That's why sometimes it feels like the food is stuck there, because the top part of your esophagus is skeletal, and skeletal can feel things. And then so sometimes it feels like that the food is stuck in your throat, and it probably is. And eventually it'll work its way down, because remember, the skeletal muscle doesn't peristalse. But eventually it'll kind of work its way down until it gets to smooth muscle. And smooth muscle can't feel anything. So that's why you kind of lose that sensation. Now, we have to be real careful with how food enters our stomach. Our stomach is not supposed to stretch. Our stomach is a holding chamber. It can stretch a little bit, but we can't just let our stomach fill up and it'd be like a water balloon. It fills and fills and fills, and it can tear. So where our esophagus is, draw this little picture. This is our stomach, this is our esophagus right here, and this is our stomach down here. We have a little door right here, and that door is called a sphincter muscle. Your iris, the colored portion of your eye, is a sphincter muscle. So that gives you a perfect example of what a sphincter muscle looks like. A sphincter muscle is a circular muscle that has a hole in the middle of it. And usually something goes through that hole. Your pupil is a hole. Your pupil doesn't exist. It's a hole. Your pupil is not black. The inside of your eye is black. But if you look at the colored portion of your eye, your iris, that's a perfect example of a sphincter muscle. And a sphincter muscle is made from smooth muscle. It will constrict and it will dilate and constrict, dilate and constrict. Well, usually you have a tube that goes through it. So that can squeeze that tube shut, or it can open that tube up. So it's kind of like a little doorway. And what happens is our stomach can only get so full. So we have what's called the cardiac sphincter, and cardiac means heart, so it's a little bit misleading because it has nothing to do with your heart. It's just called the cardiac sphincter because it's up here close to your heart. And it will peristalse, it will open and close, and that allows food to drop down into your stomach. Because our stomach can stretch, but can only stretch so much. And so sometimes you might be so full, it feels like food has built up. It really has. You've eaten so much and your cardiac sphincter is closed that food has built up to the point where it's at the top of your esophagus, which remember is skeletal muscle, so you can feel it. So this doorway allows food to drop down into your stomach in small intervals. And so this was the picture that was supposed to be in the beginning. This is the picture of, not to gross you out, if you'll notice here, there's two openings. This opening right here is your glottis. That's the opening to your trachea, which is your windpipe. And what you're actually looking at is the opening to your larynx. Your larynx is part of your trachea. That's your vocal cord. And then this one right here is your gullet. That is your food opening. So this is what it would look like if you could see the very, very, very back of your pharynx, if you could see the back of your throat. Now, they're not open at the same time. This one has been forced open for this picture. And so usually the glottis, the one on top is open so we can breathe, and the gullet is closed. That's the one on the bottom. But when you swallow, they have to switch. Now, so food goes from our mouth to our pharynx, to our esophagus, and then into our stomach. And so right here is where you would find the cardiac sphincter. That's the doorway between the esophagus and the stomach. And a lot of times people think of the stomach as being the main organ of the digestive system, and it's not. The stomach is just basically like a grocery bag. It's just holding the food for you until it can go into your small intestines, because the small intestines are where you're going to get your nutrients from. So the stomach is just basically a storage area. You can think of it as a grocery bag, you can think of it as a balloon, and your stomach will swell a little bit in order to allow food into the stomach, but it can only swell so much. That's why we have to have that doorway there. It is made from smooth muscle, so it will peristalse. That's going to help smash the food. That's mechanical digestion. There's also chemicals in there, so it's going to help mix those chemicals with the food. Remember, that's chemical digestion. Okay. There is a lot of hydrochloric acid in our stomach, so therefore our stomach does not do absorption. The last thing we want is acids getting into our bloodstream and killing all of our red blood cells, and so then we die. So even though it's called the digestive system, the main purpose of the digestive system is to do absorption, and that does not happen in the stomach. Now, as you can see in this picture, our stomach does need to be able to stretch. And if you were to look at a balloon underneath the microscope, it's got all these little folds in it. And usually folds equal surface area, as we talked about in the last video. But anytime a fold is there just to stretch, you're going to see that that fold is called ruga. So all these folds that you see in this picture, those are examples of ruga. Your stomach has ruga. Your gallbladder has ruga. Your urinary bladder has ruga. Ladies, your uterus has ruga. Anytime you see ruga, ruga is a fold that's there to stretch. However, it can only stretch so much, just like a balloon will pop. Well, your stomach won't pop, but the inside of your stomach can tear. And if the inside of your stomach tears, that acid can get into your bloodstream. Okay. So it is lined with mucus in order to protect it from that gastric juice. Now, your stomach has mucus in it, but your small intestine does not. And so when food leaves your stomach and goes into your small intestine, it's just like taking a bottle of bleach and dumping it out. All this, bleach is a base, but all this acid is coming out. So nature has had to help us solve that problem. When we look at our stomach is divided into three parts, what's called the fundus, the body, and the pylorus. The fundus is what I have drawn in green up here. The fundus is where you would find the cardiac sphincter. That's where the esophagus attaches to the stomach. 99% of the stomach, the sac, is called the body. And then the bottom portion, this part that I have in red, is where you're going to find another doorway. And that's called the pylorus. Anytime you see the root word pylo, that has to do with the intestines. Now, when people have like what's called gastric bypass surgery, the doctor literally goes in and closes off part of the stomach. So a lot of the fundus gets bypassed. So therefore, they can't hold a lot of food, and so therefore they don't get hungry. So this is just another picture of the stomach. You can see the ruga that are in there, all those little different folds. Okay. Right here is where you would find the cardiac sphincter. And then down here is where you're going to find the second doorway, which is called the pyloric sphincter, which will be the last thing we talk about here. So the problem that we have, like I mentioned, the stomach contains a lot of acids, so it's lined with mucus. But your small intestine is not lined with mucus. And we're about to dump a bunch of what's called chyme. Chyme is that soupy mixture that forms inside of your stomach. It is a combination of dissolved food, saliva, and all the stomach enzymes and acids. So therefore, we have what's called the pyloric sphincter. The pyloric sphincter is the second door that we have. It's found at the bottom of the stomach. And remember, where the small intestine attaches to your stomach is called the pylorus. So this is called the pyloric sphincter. And it's a second doorway. And it will slowly open and close in order to let food leave the stomach and go into the small intestines. And we can't let a lot of food leave our stomach because there's a lot of acid there. So we have to very slowly open that in order to let stuff out, to give our bodies time to neutralize that acid before it goes into our unprotected small intestine. And that's going to be the job of the pancreas, which we're going to talk about in the next video. Okay. Now, two last things. As a baby, when you're a fetus, you're not feeding. And so it takes, even though this is all involuntary, it takes time for your brain to figure out what's going on. And so therefore, a lot of babies have what are called pylorospasms. And this is basically when the babies spit up. The babies are used to getting constant nutrients, but now they only get nutrients when they get fed. So the baby will just feed and feed and feed and feed. It's a primitive survival instinct. And their bodies, even though it's involuntary, their brain has never really had to worry about, okay, when do I open the stomach door? When do I close the stomach door? So it takes a little while for the baby's brain to catch up with what's going on. So the baby will fill its stomach up, and the stomach gets so full that the baby will spit up. Because it takes a little while for the body to figure out, okay, it's safe to open the pyloric sphincter, it's not safe. And so usually after about 2 or 3 months, the baby will stop spitting up because the baby has time to figure out what's going on. Now, something that will happen to all of us as we get older is called pyloric stenosis. The pyloric sphincter is a skeletal muscle, is a smooth muscle. But like a rubber band, over time, it's not as strong. And so in the case of pyloric stenosis, as we get older, our doors are going to get a little weak. And so the pyloric stenosis does not open and close like it's supposed to. And it could not close like it's supposed to, so stuff constantly drips from our stomach. So we might have intestinal problems, or it might not open like it's supposed to. So food stays inside of our stomach too long and gets destroyed, and all those nutrients get lost. So this is the second part of the video. In the third part of the video, we're going to continue our way down. We're going to look at the small intestine, the large intestine, and we're going to talk about the pancreas, the liver, and the gallbladder.